you lower those state lines, you're going to have access to 1,500 plans, and some of those are more than likely not to insure you. And if you can't afford it, then we get to the point where there's a role for the government to maybe come in and help you to afford that. But we can do that without creating a whole new government bureaucracy. But I fully appreciate what you're going through, and I want to help you in that.
I have a question. It's about it seems to be a major deterrent, over 50% of the healthcare, the skyrocketing healthcare costs. It has to do with the Emergency Medical Treatment and Active Labor Act that gives free emergency room care.
Okay.
I mean, it doesn't matter your citizenship, what condition it is, and you have to have follow-up care, and then you can sue them. You can, if their law says, you have to be compassionate. Okay.
What's it? Do you have a question specifically?
Yeah. I think people, if they have to have a cost, a sliding scale cost attached to it. Like say if they pay. A small percentage of it, so they're not abusing the cost.
Sure. No, I understand exactly what you're saying. Yeah.
Because ever since, according to the Kaiser Foundation, the Pew Foundation Institute, they said since 2000, insurance and healthcare costs have raised 50% since it was uncompensated care, which have to be passed down to the doctors, the hospitals, the insurance, to everybody else.
Sure.
I mean,
no, I agree. And
it's free. I mean, you need a cost, but instead of paying for an X-ray,
I'm gonna have to ask you just to make it quick.
Instead of paying for a cost for $100, you pay for $10. So you're actually having some responsibility tied to it.
Sure. No, I understand. It's a great point. And I believe that obviously with the emergency room situation, we have a huge burden when it comes to what we're having to spend for folks and going to the emergency room. And obviously, many of them are uninsured. And that's where I think the forward locating of the federally qualified health clinics in areas of under and uninsured can start to bring that cost down. Try to return the emergency room to its intention, which is to be an emergency room, and things along that line. And of course, if people have the ability to pay, they should be required to pay whatever ability they have to. I'm not going to stand up here and say I don't think that we should deny anybody health care. I mean, if somebody's bleeding in their arm or they have chest pains or whatever, in America we need to take care of them. We have the ability to do that, and we should. And so I'll fight for that. So, we had some. I think you had your, and then I'll come to you, sir, next.
Well, I hear that there's a lot of waste going on in Medicare, and Obama keeps saying, well, a lot of our money's going to come from that waste that was there. Why haven't we done that, in the past? We've known about waste. It's like I have a father in a nursing home, and it's like going to the hospital, they'll take him in an ambulance, costs $700 for a trip, round trip, back and forth. Come on, we got to do something different, and holding those kind of costs. What's going to happen to those people in the nursing home when this is pulled out from under?
Yep, I agree with you. And we've got if there's $500 billion of waste right now in the system, we should be screaming to Washington, D.C. and saying, why didn't you take care of this years ago? You're wasting our children's money because you admit there's $500 billion in waste? I think there's tons of waste in the system. I think $500 billion is a number that they really created so that they could make this bill budget neutral, deficit neutral. But we have got to take care of waste in Medicare and Medicaid. Congressman Roscom has come up with a bill that attaches an algorithm, in essence, to medical expenses. Now, it's going to be, I'll make it as easy as I can. About 2 months ago, I got a call from my bank that said, did you buy something for $950 from Walmart in New Jersey? No, I did not. And I said, no, somebody had to steal my card. Well, in almost real time, that purchase was made, and then the card was shut down, and it was investigated, all within just a few hours, basically. This bill would attach that same kind of algorithm, same kind of mechanism on medical bills and medical billing to recognize, I guess, little quirky things in the system that may need further investigating. So it can be done in real time without paperwork after paperwork and weeks and months of bureaucracy and human error in which many of these errors aren't found. It is estimated that this could save billions a year, and that's something that we need to do. I challenge those who support this bill and this funding mechanism of this bill find me the 500